Hi, Mrs. Iglesias. My name is Beth, and I'm the clinic director here. I appreciate your patience. We didn't have your son on the schedule this morning, which is why we had to wait for an available interpreter to chat with you. Sebastian hasn't had an appointment in 2 weeks. He's climbing on things at the house and misbehaving all the time. The only thing that helps is when he comes here for his appointments. I'm going crazy being stuck in the house with him. You know I love my son very much, but he needs help. I'm only one person. I understand. It can be very frustrating to need support and be unable to receive it. However, Sebastian tested positive for COVID, and we had our patient coordinator call with an interpreter to explain to you that he couldn't come back for his appointments until everyone in the house had been symptom-free for 10 days. Sebastian had a temperature for the first 2 days, and then his nose was runny. I feel fine, my husband feels fine, and my 2 other children only had runny noses. I know he tested positive, but all of us tested negative. He feels fine now. Based on the information the receptionist gathered from you during the phone call she made to you last week, as of Tuesday of last week, Sebastian was running a fever. Today is Monday. Even if he was completely symptom-free by Wednesday, today would only mark 5 days since he's been symptom-free. Our clinic policy is 10 days. No. The news said, the CDC said it's 5 days. My son needs his therapy, and you all are going to give it to him. Come here, Sebastian. Mrs. Iglesias, even if the CDC recommendations have changed, our clinic policy has not. In addition, the CDC recommendations stipulate that after 5 days of no symptoms, the person who tested positive needs to be really good about wearing a mask for 5 more days after that. Sebastian is only 3 years old, and you and I both know he has struggled to keep a mask on. He also can't get vaccinated yet, which just increases the risk that he poses to others.
Why wouldn't your clinic go with what the CDC says? They say 5 days, and he's been feeling fine. You don't understand. My son isn't well, and he needs all the help he can get. By his age, my other 2 children talked and followed directions. Sebastian is behind, and this will make him even more behind.
We really want to help Sebastian. We do. I hope you know that we all have his best interest at heart. But Mrs. Iglesias, can I make an observation?
Go right on ahead.
Sebastian's had a runny nose for just the few minutes he's been standing here with you. He looks tired and keeps rubbing his nose. I wouldn't say he's asymptomatic, meaning there's a good chance he's still contagious.
It's only a cold. Kids get them all the time, you know? I know this isn't COVID because he felt better and then he woke up like this after running around outside with no shoes on. If you'd take the time to listen to the details of the situation, you'd know Sebastian is fine. He won't get any of your therapists sick.
Mrs. Iglesias, I hope you understand, but I have to take precautions to keep my staff and our kiddos safe. We both want the same things here. We love working with Sebastian, and we miss having him around. We want him to get the care he needs, just like the other children we see here. But I have to be honest with you. Right now is not the time to be taking risks. This is why we're standing outside to talk to you, and we all have masks and face shields on.
What do you mean?
Every morning, we have a meeting. This morning, we woke up to over 13,000 new COVID cases in Virginia from yesterday. A lot of people are getting sick right now. Half of my staff is out either because they're sick themselves or one of their patients tested positive.
Well, I'm sorry that you're having a difficult time right now.
Thank you, Mrs. Iglesias. What I'm trying to get at is, even if Sebastian were 100% symptom-free, whether it had been 5 days or 10 days since he last had symptoms, I don't have an occupational therapist or a speech therapist available to see him today, either way.
Not even later today? I can come back in the evening.
No, we would not be able to see Sebastian again until, let's see, today is December 30th, 2021. We wouldn't be able to see him until January 10th, 2022 at the earliest.
So you're saying he can't even have a runny nose by then?
I'm saying once he stops having a runny nose, and does he have a fever?
No, he had a fever when we took him to get tested. Since then, he hasn't felt hot.
Do you have a thermometer at home, Mrs. Iglesias?
No, I saw a thermometer at the pharmacy and it was over $70. I can't afford that.
Andrea, don't we still have those thermometers the health department gave us? Oh, we do. Could you grab one for Mrs. Iglesias, please? And can you bring the infrared so we can check real quick?
Are you going to give us a thermometer?
Yes, the local health department gave us some to give out to parents.
Thank you. What's your name? Betty?
Beth. Thank you, Andrea. Here's a thermometer for you to use at home. You'll need to take Sebastian's shirt off and place the tip of the thermometer under his armpit. Okay, see? Andrea took his temperature with our thermometer, and Sebastian has a low-grade fever.
100? But he doesn't feel that hot. I had no idea.
This is why we're really trying to be careful, Mrs. Iglesias. I hope you can understand. None of the kids we've seen recently who tested positive seemed sick when they came to us. And unfortunately, it seems like Sebastian is still feeling a little bit under the weather. So here's the plan. Keep monitoring his symptoms, and once his nose stops running and his temperature stays under 99, start counting 10 days from that date.
Okay, so if he wakes up tomorrow and his nose stops running and he has no fever, he can come in on January 10th.
If we have an appointment available on that day, yes. And if any of his symptoms come back, you'll need to start counting down those 10 days again. He needs to not have any symptoms for a full 10 days before he can return to the clinic. So it's important to keep checking his temperature.
So it's 10 days, not 5 days then.
The new CDC guidelines were just updated on December 27th, 2021. Like I said, our company policy is still 10 days. If for whatever reason this changes, I'll make sure to let our patient coordinator let you know, okay?
Okay, so Sebastian's appointment for today was canceled then.
Yes, Mrs. Iglesias. Please take Sebastian home and make sure he gets plenty of rest, okay? I hope you feel better soon, Sebastian.
Thank you, Beth.